Hi, it's Dr. Thomas Gerber again, the Associate Editor at Mayo Clinic Proceedings, who's responsible for our journal's online and social media presence. I'm also a Professor of Medicine and Radiology at the Mayo Clinic College of Medicine and a member of the staff of the Division of Cardiovascular Diseases and the Department of Radiology here in Rochester, Minnesota. Today we'll discuss the editor's choice and the highlights in the November 2014 issue of Mayo Clinic Proceedings. Our editor's choice this month is an original article authored by Dr. Kuan-Chen Chang from China Medical University Hospital in Taichung, Taiwan, and colleagues from several other Taiwanese healthcare institutions. They report an analysis of the National Insurance Reimbursements Claims Database in Taiwan regarding the risk of first ever ischemic stroke in young atrial fibrillation patients who had no risk factors except female sex that would have recommended anticoagulation for stroke prevention. The question this article addresses is whether our current risk stratification tools on which we base our decisions to anticoagulate or not patients with atrial fibrillation are accurate for individuals under the age of 55, and that's an important question for our daily clinical practice. One of the highlights in this month's issue is an original article authored by Dr. Gina Demento and colleagues from Mayo Clinic here in Rochester, Yale University, and from the vitreoretinal surgery practice in Edina, Minnesota. They describe the progression of 3 uveal melanocytic lesions to melanomas after initiation of tumor necrosis factor alpha inhibitors given for treatment of chronic inflammatory diseases. In the accompanying editorial, Dr. Takami Sato from Thomas Jefferson University in Philadelphia, Pennsylvania, discusses the data on a possible correlation between TNF-alpha inhibitors and the development of malignant neoplasms and the possible mechanistic explanations for malignant transformation of uveal melanocytic lesions. Another highlight in this month's issue is a review article authored by Dr. Joseph Feuerstein and Dr. Adam Chaifetz from Beth Israel Deaconess Medical Center in Boston, Massachusetts. The authors discuss the epidemiology, diagnosis, and management of ulcerative colitis, a chronic condition that is common among the primary care population. And our third highlight, which comes with CME credit if you complete the appropriate documentation, is a concise review for clinicians written by Dr. Kelly Corcutt and Steve Peters from Mayo Clinic in Rochester, Minnesota. These authors provide a clinical overview and an update on the management of severe sepsis and septic shock. Online access to these Editor's Choice and Highlights articles is free during the month of November of 2014. For more information, please visit our Mayo Clinic Proceedings website. And we'll see you again in December. Thank you very much for watching.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.